boxes, cereal boxes, and et cetera, given the nutritional content of food items and et cetera. Is that the same kind of standardization that they're trying to do in terms of health?
That's it exactly. That's it exactly. And that's something that I applaud too. You know, those of us who have made careers of trying to help people live longer and to be healthier for a longer period of time certainly applaud this new the nutritional information that's being placed in certain places to help us buy our food more intelligently and in ways that's going to make it help us live longer as we take it and consume it into our bodies. But yes, you are correct. That's exactly what it purports to do.
You know, when we oftentimes we hear a number of alphabets that are associated with many of these terms, HMOs and HCOs and
PPOs and things like that.
Now, why don't you give our audience some of those initials this morning, and to explain exactly what they are and perhaps the difference between one as over against the other and that kind of comparison, so that they'll have some idea about what we're talking about.
Well, in reality, it's really hard to discern the difference in many of them. The HMO is Health Maintenance or Organization, and it really purports to try to do that kind of thing. Under the HMOs, one of the proponents under that is like free examinations. This is an effort to get people to go in and get routine examinations that the HMO says if you get 1 exam per year or maybe 2 exams per year, that there's no cost at all for this, because if you can detect something that's on the horizon or something that's about to take place, we can catch it early, and that thereby we can save a lot of money. Preventive care, right. And so that's one of the proponents of an HMO plan, is trying to get your teeth cleaned on a routine basis, going in twice a year to get your teeth clean. That's important because it can detect other problems that may be existing that could create other health problems within the body. A lot of people are not aware of the tremendous health problems that can be that can happen when a person does not take good care of their teeth and things of that nature. So those are two of the kinds of things that the HMO and the PPO. A PPO just means a preferred care provider, and it's the same kind of thing. And then what happens, you find that once these organizations set up these different types of plans, then they go out to various hospitals, they go to certain physicians and get them to tie into this particular plan. The hospital says that for these particular services, we will accept a fee of this amount of dollars. And it's really kind of the same thing that we're talking about now in managed health care. The physicians who subscribe to this program say, well, although I normally charge $250 for this particular procedure, by virtue of the fact that I'm a part of this PPO and you're going to have large numbers of people coming to me, it's going to increase my patient load, I'll do this procedure for, let's say, $200. The end result being that once we get all these individuals and factors together, that costs can be curtailed by virtue of having large numbers of people participating in a plan that's designed to do a certain number of things to provide health for individuals.
Now, it does seem that most of these things are consumer friendly. I mean, all of the things that we're talking about in terms of the reforms that are going on in health and nutrition and et cetera, all of these things seem to be more geared toward the consumer. Is that correct? Is that a fair assessment?
On the surface, you're exactly right. They would appear to be consumer. Now, there's another portion of this particular concept that we haven't brought into play yet, and that's every time you make a sweeping change in the way health care is provided, somebody out there is going to get hurt. It could be an insurance company, it could be a hospital, it could be a group of doctors, it could be any number of individuals, all of whom have people that we call lobbyists that are paid to lobby for their best interest wherever the legislation is being passed. And so anytime you talk about anything as far-reaching as managed care is, this is a totally new concept. Although it's been talked about for a long time. I can remember 15 years ago, Senator Ted Kennedy talking about this same kind of program. It was talked about, people said it sounds like a good idea, others said it will never work. Nothing ever happened. you know, if nothing, if something happened, I think it will, I can applaud this administration for trying to take the necessary action and the steps to get a uniform managed care plan on board for us. But there are going to be problems because there are a number of people who are going to be diabolically opposed to that. You have some politicians that say if the Democratic administration is able to push this through, that's going to be a feather in the cap of the current administration, and we don't want any feathers in that particular cap, so we're going to be opposed to it just because the current administration. So it's politics, sure. So we've got all those agenda that are hidden out there that nobody can see, and they don't always rise to the surface until such time as some action is being taken.
Let's talk about, excuse me, from your perspective, some of the issues that black people ought to be especially concerned with in terms of some of the health care issues. You know, I think, for example, we know that black people have the highest death rate in cardiovascular diseases, strokes, cancer, and et cetera. What can you say this morning in terms of the issue of minorities in health care in America?
Well, I would say that I'm probably proudest of the fact that something is at least being discussed, and I feel something is going to happen, whether it be this particular plan or some modification of the plan. I feel it can only be better for the underserved. And when you talk about underserved health-wise, you're going to find large numbers of minorities, poor people, uneducated people, people who need the services the most, are the ones that have been left without it for the longest period of time. So I can see it being nothing but a panacea of good things to come as it relates to health care for minorities. And I applaud the fact that we're trying to move into that direction. Now, we, on the other hand of the spectrum, have to take action ourselves. We've got to be willing to advance these ideas. We've got to be willing to say to our legislators, to the people who vote our sentiments, that we think this is the kind of plan that ought to be implemented. We can't stay at home and not go to the ballot box, or stay at home and not talk about this, or not become intelligently informed about it. A lot of people say, I hear it all the time, they're going to do whatever they want to do without any input from me, and that's really not the case. And all of us have some input to make into these decisions that are about to be made, and we need to be as intelligently informed about them as we can. And I think programs like the one you have here are an effort in doing that.
You know, I think it's quite